we brought together a panel of ALEC staff and community members that we thought would cover sort of a broad spectrum of where we're at and considering how we can build on what we need to do in the future. So I'd like to introduce our panelists. Firstly, we have Dr. Randall Berlin. Randall began his medical career in Calgary in the emergency department in 1997. In 2004, he started working part-time at the ALEX, and in 2012, he was drawn in, as many of us are. He left emergency medicine and began working full-time at the ALEX. He works at both the community health center, where the youth age out when they turn 25. They move over to the community health center, and at the youth health center, he has a special interest in lifestyle medicine and in men's health. We also have with us Aidan Smith. Aidan is a case manager, a registered social worker at the Alex Youth Health Center. He provides system navigation, skill building and emotional support strategies in the day-to-day sort of services that we deliver to youth. We refer to these case managers as sort of the quarterbacks to help the youth through the navigating the system in its many forms, and couldn't live without them. So happy to have Aidan here to represent that team. Veronica Rogalski, she's one of our primary care nurse practitioners. She completed her bachelor's, and master's degrees in nursing at the University of Manitoba. She's been with the ALEX since 2013, and she works in adult and youth programs and is also one of our youth bus practitioners. Michael Williams is a registered psychologist who's amazing and has been a clinical counselor at the Youth Health Center, providing one-on-one counseling support for, not sure how many years, Michael, but quite a few, and we appreciate you. Monica Engelman has also kindly agreed to join us. She's been accessing the Youth Health Center for many years and is currently enrolled in the Justice Studies program at Bow Valley and continues to grow. So I will present questions to the specific panelists and then open the floor for other responses. First question is, I guess, for Aidan. How do you see some of the upcoming challenges with our youth as we get closer to the return to, quote, normal activities in life?
Well, first of all, Deb, I just want to thank you so much for moderating this this webinar, and I want to thank Meryl, Jen, and Joy, and everybody who has spoken before me with those beautiful words. And I think I'm definitely going to run into very similar motifs here. I think during COVID, I think it forced a lot of us to attempt to revisit how we're providing services. And I think us here at the ALEX, we really had to pioneer a new way of engaging our youth. So I know at the onset of COVID-19, there was a bit of a drop off in engagement. And then I think it took a lot of us to come together to say, how can we rebuild this engagement, and how can we maintain this? Because obviously, as COVID grew more and more severe, we knew that those connections needed to be stronger, and they needed to be there. So I think again, all of us did an amazing job of reinventing the wheel with outreach, and more particularly, electronic or online programming. So I think with that, in terms of future challenges, we're going to have to look at that wheel again and see how we can smoothly reintroduce in-person programming, and not forget about the new service delivery that we've been using so efficiently over the past year. But how can we now create a new form of service delivery where both electronic and in-person means are being utilized? Because I think again, COVID saw a lot of challenges and a lot of losses, but it also saw a lot of successes. We got a lot of youth connected to electronics, and as we know, in this day-to-day world, being able to connect online is one of the most quintessential components to connection now, and connection to community. So I think the question is going to be, how do we take those strengths and merge them into a new service delivery where we're both utilizing the very, very important dynamic of in-person service delivery, but we're also not completely forgetting about our online engagement, our technical engagement.
I love what you've touched on, especially there, Aidan, in that going forward, I think we do need to combine the virtual tech phone support with the in-person, and I think again it's going to allow us to stay in touch with many more youth going forward. Any other comments from any of the other panelists before we have another question? With that, I'll move along. I've got we tried to choose some of our highlighted questions we thought would be of interest to everybody, and I've got one for Veronica. Nurse practitioner Veronica, do you think that the pandemic has brought about any positive outcomes for youth?
Thank you, everyone, for joining us today, and for supporting our youth and the work that we do at the Alex. I'm happy to be here today. So I get this challenging task of trying to explore the positive sides of the pandemic. So challenge accepted. So I think there are a few things that I'm kind of thinking about. One of the things that I would like to highlight is the incredible ability to adapt. And we've been kind of seeing our youth adapting to this ever-changing nature of this pandemic, in terms of, their school and home life. And I think this ability to adapt is a life skill that will serve them really well in the future, and will definitely build the resilience that is very important for well-being and better mental health outcomes in the future. The other thing that I'm kind of thinking about, it's more of a philosophical maybe thought that I have, is that throughout this pandemic, maybe there's a new perspective that our youth may be gaining, and maybe a new appreciation for in-class learning and school setting, where they can probably see school as a place where they can learn, which is really important, but also a place where they can learn about healthy relationships, where they can connect with peers, right? And connection is really, really important part of their development. And also for some of our vulnerable youth, school is a really safe place to be, especially with the ones who don't have stable households. So, and being able to build this support network through school and the staff and the teachers is really important. So hopefully this will kind of, again, will give them more appreciation for, going back in September, and, give them more motivation and energy to be back. So the other thing that I think is positive is maybe the opportunity to explore different styles of learning. So, in-class learning versus online learning, which can again serve them well in the future. Some other, I think, positives of the pandemic, and they probably apply more so to some subgroups of our youth. So for example, as I think Deb mentioned as well earlier, so some youth really benefited from online learning, and especially youth that struggle with social anxiety or other forms of anxiety, or some youth that struggle with bullying at school, right? So I think the online learning provided them with the opportunity to be kind of more productive and focus on their schoolwork, and kind of to avoid some of the stressors that they may be dealing when they go to school. In terms of other subgroup of youth, I think that has more stable household situation probably benefited from spending a little bit more time with their family members, right? And maybe reconnecting with their family members, and maybe learning other life skills like, cooking, doing laundry, watching after their, younger siblings. So, and I think that could be also is a positive thing. In terms of kind of like maybe indirect positive aspects of pandemic would be definitely related to the service provision. And again, at the Alex, we were able to expand certain services. We were able to build on an existing ones. We were able to restructure some programs to better address the complex needs of our youth. And definitely, I think the pandemic really strengthened the importance of the interdisciplinary team and just wraparound services. And definitely outreach programs were really, really instrumental in how we executed our services. And I think from a clinical kind of perspective, that allowing or adopting virtual care was a huge thing for us as providers. And I do see a lot of benefits in providing virtual care to our youth because it really, really improves their access to care, especially to some youth that, again, had struggles physically coming to the clinic or to the bus during lockdowns. And and some of these models of care, we will be able to continue expanding in the future past the pandemic. And I think those are positive things, more innovative ways of providing care and expansion of the services.
Wow.
Yeah.
Veronica, thank you. That is spot on. And you've covered so many key points. And I just particularly love the point that I think there's a lot of kids that appreciate going to school actually is not so bad. There's a lot of things beyond sitting in class that they really benefit. So yeah, thank you for that summary. I'm going to put Michael on the spot. I'll actually remind participants too, if you've got questions, throw them in the Q&A and we'll do our best to cover some questions at the end. So so Michael, as we're, are we seeing different experiences for different groups? For example, the LGBTQ+2+ youth or those struggling with addictions, are they having different experiences? And if so, what are you seeing?
Yeah, thanks, Deb. Certainly. I think maybe to start off, I'll speak to some of the similarities about the youth that I see coming to access the Alex, and then some of the unique challenges as well. Certainly, the youth that we see coming in our doors are at risk for negative mental health outcomes, and at a much greater percentage than the general population. These are youth that are coming from what would be known as adverse childhood experiences. So broken homes, domestic violence, abuse, physical and emotional neglect. Many of them have bonded together with their peer groups because they have experienced that safety and connection in their life has been absent or broken or unavailable. So I think the Alex started out as a grassroots organization, and a big part of why we're successful is building those relationships and being available to youth that don't have other places to go. These are youth that typically won't access institutionalized healthcare because they don't feel safe, they don't feel like they are accepted or they feel discriminated against. Some of the things that I've noticed with our youth in particular, I'd say 2/3 of my caseload would typically identify as LGBTQ or transgendered, and the risk factors go up even higher for that group. We're looking at 6 times higher for suicide than the general population. So, these are youth that in their own life don't feel seen or heard. Something as simple as going to get a new apartment, they may feel discriminated against. So, think about the pandemic and how marginalized and isolated people are feeling. Imagine what it's like for them who are already looking for housing, looking for work, accessing the food bank. The barriers are just tremendous. So the ALEX, I think one of the great strengths of the ALEX is how we build relationships. The number one thing that I hear from the youth that I serve is that they feel safe. The referrals that we've got at the ALEX, they come because they've had great experiences with our doctors, with our youth bus, with our drop-in center support, and it's word of mouth. And I think that's really amazing that we've built ourselves that way, and so many youth, they're the ones that are telling us what we're doing right. So yeah, I'm thinking in terms of since the pandemic, one of the greater challenges has been isolation and loneliness for youth, and not being able to access. So I think it's so great that the ALEX has, that's been a strength for us, and we've made efforts to connect through virtual supports and youth bus and having access to the caseworkers. So it's hard to really represent how meaningful that is, and just from the outside world, because I think a lot of what we do is preventative care, and the heart and soul of what the ALEX does is building those relationships and safe connections. In a way, I consider us a little bit as attachment surrogates. We think of attachment as a process where, early in life, we learn safety and security and how to navigate the world and communicate with others. Our youth have had to, figure out ways to survive. They've had to navigate the world in a way that isn't so friendly or accepting and accommodating to them. So, when they have this experience, I think Jen talked eloquently about how important it was to be available, for us to be there in the moment when they need us, because that fear is there that, the world is not going to, things aren't going to happen, good things aren't going to happen in the world for them. So, looking forward to what that looks like. So, a lot of the youth that I've talked to, some of the challenges have been related to, not being able to gather with their friends, or fears about getting employment, and certainly, when you're at home alone, isolated, sometimes driven back into living environments that created mental health concerns in the first place, things like depression, anxiety, domestic violence. Youth, when we talk about negative rumination, worry about the future, all of those things get amplified. So what do youth do? They rely on the things that can help them cope by numbing out their feelings with substance use, and some of the more survival-based skills that they've learned in their life. So yeah, I think particularly for the LGBTQ and transgender population, it's so important that they have a place that they feel safe and heard, and that the ALEX has been a big part of that.
Beautiful. Thanks, Michael. So well said. And actually, this is a good time maybe to ask Monica. And thanks again, Monica, for taking the time to join us. What would you like other youth to know about how the ALEX works, who we are, what we do?
Everyone stole my introduction, so I don't know how to introduce anymore. So I'll just cut right to the chase. I would probably say something along the lines of, like, it's so important for these youth, especially the ones at risk, that they have access to like doctors and like outreach programs. And like what a lot of other people said is that like like you have these opportunities for these kids to come here or get access to different programs. And I think it's also really important that the Alex has this such like, I don't know what word I'm looking for, like it's so judgment free at the Alex. And like the first time I ever went to the Alex, I was on the verge of tears because I had I had not no one to talk to. I didn't know who to talk to the first time I went there. And the first person that greeted me with such warmth and a smile that I will never forget. And I still see that at the Alex staff today. And it's also very important that like the Alex offers like treatment programs that would usually cost a lot of money if I went to a private doctor or dentist or other people, that the Alex usually does it for free. They have the free dental bus, they have the free healthcare. I can go see a doctor for free. And it's also really important, I think, that the youth know that the Alex takes things very privately, very seriously. And that like when I was a teenager, I was always worried about like my parents finding out about this or that. And like I would be so scared about my parents finding out if I was potentially pregnant or like if I had an addiction. And like especially in toxic households, those would just create even more problems. And the Alex takes that privacy so seriously that I didn't learn this until I was older, but like that like they will not tell your parents about anything. So I think that's really important.
I love hearing your perspective, and Monica, thanks for the two things that you mentioned that I think we all are so work hard to do and be proud of, is non-judgment and respecting privacy. Of course, if you're the usual, if you're in danger immediately to yourself or others, of course, we have to tell somebody. But other than that, we really try to respect that we are a safe place for kids to come. If we can safely involve caregivers and parents, absolutely, we encourage kids, but sometimes that's just not possible, as you've alluded to. So thank you. Dr. Berlin, are you ready to be put on the spot with a great one? If this pandemic has shown us anything, it's that society can be adaptive when we need to be. And the red tape, if it were all off the table, what changes would you love to see in how we address youth mental health? Your dream.
Thanks, Deb. I'm going to break that down into my 3 wishes. If I had 3 wishes, my first wish would be for the general public to have more understanding, more compassion for at-risk youth. My second wish would be that that basic needs were met for everybody. It's hard to sort of heal when your basic needs aren't met. So, I mean, I would wish for a guaranteed basic income for everybody. I would wish for safe, affordable housing for everybody, because without those 2 things, it's hard for a person to start the healing process. My third wish would be a more comprehensive medical team. Our current medical system is very physician-centric, and I don't think that serves clients or patients well. We need a balanced team, you know, whether that's psychologists, social workers, pharmacists, nurses, you know, navigators. There's lots of people that are needed to help in the healing process. And I think the Alex does a great job at putting a team together, but I know we can do better, and we need, you know, more support to develop that team. So those would be my 3 wishes if I had 3 wishes.
Those are great. I wish I agree with those. Those are awesome wishes. Any other wishes that the panelists have? If we could add to the wish list, is there anything off the top? I think Randall's kind of covered the meat of it all. Thank you. So I have another question that I'm going to, well, first of all, I'll open this to all the panelists. We have a question about funding, and I think we'll ask Meryl to answer that. Well, perhaps you want to answer that one maybe now, Meryl. This the question as to, I know you're a special guest on the panel today. Has our funding diminished since COVID? If you don't mind stepping in on that.
Well, it's an interesting and difficult question because during the pandemic, we've been able to access a lot of short-term emergency grants, and we did have an influx of donations during COVID. We also increased our budget because we were running ACEs, the Assisted Self-Isolation Site. However, in the coming year, we are probably facing a deficit, and we have a huge fundraising burden coming to the Alex, but we're not asking for any funding today.
To follow up, though, maybe I would ask Meryl, in what ways do we need support? How could people be of help if they wanted to be? I know this is not a fundraising mission today here, where it's an educational one, but.
Well, our fundraising target for this year is actually $4 million for the entire Alex, and $1 million of which will be for the Youth Health Center, which is a pretty onerous fundraising task. We've never had to raise quite that much money before. The demand is so high, and we really have to step up, especially in the mental health area. We're seeing such increased demand, and really we were at a mental health crisis prior to the pandemic, and now the future will be far more challenging for us. So just to keep things going the way that they have been, we need to raise about $4 million and $1 million for the Youth Health Bus and the Youth Health Center combined.
Thank you. One of the things I always like to tell people is to try to remember that we do know that for every dollar spent that we put into helping these youth, we have quite a significant return on social investment in long-term savings for these youth accessing care. So it's always that balance of putting money in for prevention rather than, but also needing money for treatment and care.
I'd just like to add to that, Deb. That's a great point that you're raising. And now that we do have some evidence of in addition to the stories people tell us, because we always knew we were being successful in altering young people's life course, but now we have some hard numbers to back that up. And we know that, especially in youth, this is the time to intervene. We can alter life trajectories by intervening in that period of adolescence and emerging adulthood. So the Youth Health Center has always been near and dear to my heart, and a really important place to look for best practice, look for biggest return on investment. And that's what we're doing. And thanks to you, all of you.
Thank you. Yes, I always like to say one of the reasons I love working with youth is because if you can just nudge the trajectory a little bit, you can have a big impact. It's like, shooting for the moon. If you just nudge the rocket path of, a fraction of a degree, the outcome will be significantly different. And with these kids, a lot of them, a little nudge, a little support will make a big difference. So the question I'd really like to throw out to the whole panel is, and this will be relevant hopefully to all of our attendees, is what are the warning signs that a youth may be struggling with their mental health? What can parents or caregivers or concerned other people do? Kids present differently than adults sometimes, and yeah, I'd like to throw it open to the floor.
I can kind of start it off here. I think for me, one of the big warning signs is disengagement. I think even if you have a dialogue with it, with a youth, and they're not doing well, at the very least they're still willing to talk to you, and they're still willing to explore options for growth, and for strength building, you know, those skill building, that you know, building upon executive functions. I think when it starts to become concerning is when a youth slowly disengages themselves from either natural supports or synthetic supports like the ALECs, where they don't show up to appointments anymore, they don't respond to texts, phone calls, emails. I think when we start to see that drop off is when that concern can certainly start to rise. So I think, you know, in terms of identifying those things, I always find it so important to be open in communication to these youth. So if I have a youth on my caseload who hasn't reached out to me in a few weeks, I'm going to try and call them and say, hey, I've just noticed that you haven't been as engaged with me. Are you okay? How can I help you? How can I empower you and bring you to a level where we can continue this conversation about making sure that you are supported. But yes, I would say one of the risk factors here is that lack of contact, that disengagement.
Yeah, Deb, I would like to add to this what Aidan started us out with. It all goes back to the relationships we have, because we're only able to notice those small things if we have that foundational relationship prior to anything happening. And that's why I'm so glad that the ALECs places so much emphasis on that relationship building piece. That is the one part. But I also would like to point out that there is a real opportunity for educating our youth, and in psychiatry we call it prodromal symptoms. It's just what happens with you when your mental health is about to deteriorate. How can you, knowing yourself best, being in charge of your own mental health and wellness, how can you reach out before things have completely gone sideways, perhaps? I'm a nurse by my background, so health promotion, illness prevention is a really big thing, and I really, you know, like these really vulnerable conversations with clients, and have that talk about what does it look like when things are about to get worse for you. We talk about a vegetative shift. Are you eating more or less? Are you sleeping more or less? What has changed in your life? And often youth are incredible and very intuitive, and they can tell you what has happened the last time when things were not going well for them. And then you can come up with a wellness plan and give them some, you know, distinct tools to be able to be empowered. What Aidan was touching on, it's all about that peace and empowerment, even when things are not looking good. So I think it's the two parts. There's a responsibility and accountability on us providing a service, but then we want our youth to feel that they're prepared for whatever comes their life. Veronica was talking about life skills. I think knowing yourself and caring for yourself, being able to support, get the supports you need, are very powerful skills that set our youth up for success.
Michael, you look like you had a comment to make.
I think you've both spoken to this very well. You know, I would just say at times youth can end up acting out in ways of anger, or sometimes what can be confusing for parents, you know, pushing them away, protesting, sometimes relying on substance use. And those are the times to validate and show up and engage with them, so that, you know, that some of those behaviors aren't about being bad or, you know, not wanting the relationship, but they're hurting. So, you know, just being aware that any significant changes in behavior sometimes can be a red flag, and yeah, making a point to engage with them and really validating how they're feeling.
Yeah, one of the things in my mental health teaching with physicians that a point that we like to drive home is that oftentimes depression in youth can present as irritability. And so when you get a really irritable person, you kind of wonder, I use the analogy with the kids all the time. If you're walking down a path and you see a cute little puppy and you bend over to pat the puppy and you think, oh, what a cute little thing. And then it snarls and bites at you and you think, oh God, what a dumb dog. But you look and its legs in a trap. And the analogy is that, you know, typically creatures don't lash out if they're not hurting. And so just looking beyond behaviors, a practical point too for parents and caregivers, what I'm seeing in pretty much every youth and many adults, sleep patterns are probably the first thing I talk to kids about. And without the regulation of the routine of school, particularly, or in and out, that's sort of thrown things off. But looking at removing tech and not just asking them to, you know, plug it in the hallway, because I've seen that plugged in with the case artfully positioned upside down and the phone not in the case in the hallway. I've heard of that. So really removing tech and getting them some sleep, which is key. Yeah, the other to see if there was a question too about the youth bus, how the utilization, what happened with the youth bus utilization with the pandemic. That was a juggle, and I have to say hats off to our youth bus teams, particularly I'm thinking our youth workers who were madly burning up the text data, reaching out to kids who weren't able to be at school. We've still gone to the school sites when we can, and when the schools were absolutely shut down, at times we went and set up at the youth center and just worked virtually from there. So I would say that the tracking the kids down has been a little bit challenging for some of them, but the flip side is we've had a lot of new faces coming, and the schools are great about referring those new. And so going forth in the fall, we're really hoping to be ramping back up in all capacities, and hopefully with schools planning to stay open, it'll be easier in that sense. And we're always looking with our community bus too. We've got more youth sites and we know what an impact it makes, so we're always looking to expand our youth services. So Veronica, did you want to add anything on as another youth bus person?
Yeah, so I think that I just wanted to also kind of emphasize the community partners and specifically schools, right? And success coaches and guidance counselors at schools, because they were quite instrumental in how we provided services and reaching out to the youth that were not physically at school. So that was really, really important. So hopefully we can continue building on those relationships with the school staff.
Yeah.
And also the families, right? So we were able to kind of like, again, for the youth that do have some more stable supports through their family members. So those were really important kind of alliances to make as well. Again, to be able to provide in-person and virtual care and stay connected with the youth that we work with. So
thank you.
Yeah, I think we did okay.
I think so too. There's so many good questions, and I know we'll try to get to them all even by email if we can't, but I would really love to address this one that's come in about the challenges that racialized youth have in accessing culturally appropriate mental health care. And a question about what the Alex might be noticing or learning in that regard. And I'd love to throw that open to maybe Aidan, you might want to lead off, or Randall, whoever, anybody.
Yeah, for sure. I think the imperative to connect our youth with appropriate cultural supports has been something that's ever growing. It's something that's incredibly crucial. I think the Alex has been doing a very good job of not only taking accountability, but also walking the walk as well as talking the talk, for lack of a better term here. And I think a big example of this is our current work we're doing with our Indigenous strategy. We recently opened our Indigenous space the other day. And we're working with a lot of elders in terms of implementing talking circles, trying to build that community, but also trying to really cement that the ALEX is committed to this dialogue of anti-oppressive practice, and looking at critical race theory, and looking at how that applies to the individual's whole health. So I think the prospect of cultural supports is something that is always of great importance, but I think it's also something that the ALEX has really taken on. And I think and I think in a lot of ways we're really spearheading this when we talk about things like our Indigenous strategy, and also too, in terms of that accountability piece. If we know that there are gaps in our service delivery, we have partnerships to fill those gaps. So if we have a youth that come in, that access our doors, my motto is that if I can't help you, if this is something that I can't assist with, I'm not just going to shut the door and say goodbye, good luck. I'm going to make sure that you're connected with additional supports. So that can range across a vast variety of non-for-profits and organizations that are, again, spearheading this work in terms of building that diverse community and that cultural component. So I think it's something that the ALEX is taking extremely serious. And
Aidan, further to that, I know this would be just totally off the top of your head, but the question came up, what's the ethnic mix of youth that are accessing our services? Anybody, it's a definite cross-section.
I can answer that question.
Sure. Oh yeah, Meryl.
We collect detailed demographic data on people who come to the ALEX. And although data collection's been a little bit poorer during COVID, we can say that about a third of the youth that come to the YHC are Indigenous, and the rest are about another 60% are Caucasian, and then 10 to 12% are, actually I just made 110%. So let's say 30% are Indigenous, 60% are Caucasian, and 10% are from a whole variety of background. Most of them are fairly recent immigrant youth.
Thank you. There's a really good question here that about agencies that have youth programs, but not necessarily for at-risk youth. How do we make sure these youth feel like they can access the mental health supports at the ALEX? Any thoughts?
I can take this, Dr. Deb. I think it's well known that stigma is such a barrier to care, especially when it comes to mental health and addiction. And I think we all can play a role in combating stigma and just talking about mental health in an everyday context. And I think whether it's our loved ones at home, our friends, our other networks, and I'm also inviting other service providers just to keep that conversation going. If you have a brain, you can have an addiction. It's not failure as a human being. It just means that you're human. If you struggle during a difficult time, like right now, it means you're human. It doesn't mean that you're not a good person, or so there is still such a barrier that society is creating, that there's something wrong with you if you need mental health and addiction support, that there is something, you know, different about you. I think at any given time, like all
Lost you again, Jen. Maybe Dr. Randall, would you like to sort of jump in with your thoughts? Sorry, Jen.
Yes. I would say the bulk of what we see at the youth health clinic is mental health related. And I would say our resources at the youth clinic are pretty stretched right now. So for people outside the ALEX, accessing our mental health supports, I think, would be pretty limited right now. And it sort of goes back to my three wishes. I think, you know, we need more sort of community-based health centers that have multidisciplinary teams that, you know, if your family doctor's, you know, in a certain part of the city, you know, hopefully that clinic has resources to meet your psychological and your social needs. Yeah, I think it's a big challenge for the whole city to meet the mental health needs of our population.
Yeah, I would agree. I do want to echo as well that honestly, the schools, that they have been amazing, and the teachers, once the teachers have seen us out there, we have a lot of referrals from teachers of kids. And Jennifer, I'm going to try to pick up on what you'd said earlier about how it's not cool to access mental health. And I think I have a new vision for the ALEX mission statement, making it cool to ask for help, you know? And so nothing warms my heart more, and I'm sure every single person on this panel can relate to this. And Monica, you might have had this experience where kids hear about the ALEX from other kids, and it's kind of like, you know, hey, that's a cool place to go, it's safe. Have you ever come across that, Monica? Or shared the ALEX?
Yeah, I have. I had a friend, I remember they were struggling with like not making rent and like working like minimum wage, and I remember I'm like, hey, go to the ALEX, they can help you so much.
Yeah, that's great. Word of mouth is our, that's when we really know we've done a good job. So I'm thinking maybe it might be time to move along. I'll ask our tech team if they've got anything more. There's still some great questions, but panelists, is there anything else that we've left untouched that we could handle in about 2 minutes? And
Yeah, I don't know if this ties into the last conversation, but just briefly to make a comment about trauma, I think there's going to be a huge aspect of what that looks like. And I think currently part of the challenges with accessibility to our system right now is acute care and some of the sort of surface symptoms that we look at. And I'm hoping that as we go forward, we can maintain sort of that scope of practice where we can also address issues related to trauma. And those, often when you meet with somebody, you're not just opening up one issue, but you're opening up a lot of issues related to their life. And, you know, once they build those relationships and connections, that's a really critical time to make an impact and make change. So I'm hoping, you know, in the broader scope and the bigger picture, that mental health can transform through the pandemic, and we can have a more responsive and humanitarian attitude towards mental health.
100% echo that. I think to me, one of the blessings of the pandemic is that mental health has become a very, very common accepted topic. Corporations are recognizing it much more. The general, I think that it's a real, one of the bonuses, and hopefully we can build on that. There's a quick last question that was, they'd like me to answer. The online school, helping kids transition to online school. Being that we're not teachers and each teacher has their own sort of classroom outline and whatnot, we can't address the academic part, but we do our best to try to help kids with their routine and social rhythm. The tech, if they can get it, but really helping them to learn to build in getting to bed, getting up, having, you know, something to eat, the social rhythm that is key to success no matter what they're doing in life. So I'd like to thank everybody for this conversation. Great questions. I'm feeling really hopeful. I love always to look at what can we do. Sitting and moping isn't going to get us anywhere. So acknowledging issues and looking at where we can go forward. It's for the youth that we all do this work, and that's why we'd really like to share this little segment with you. This is a slam poem done by one of our former youth Huda Mohammed, and Huda has spoken before. She met me on the bus in grade 10 with really what was crippling anxiety and keeping her from going to school. And through the work of our team and seeing me, she shocked us all and came in grade 12, stellar, turn around with a slam poem that she presented live in front of a big audience, and none of us could believe it. Happy to say Huda is now in social work at the University of Calgary and rocking it. So Huda kindly recorded this slam poem for us.
When I was in high school, I had anxiety. Felt like I was stuck in a world that tried to quiet me. I don't know why, but everything just seemed to frighten me, tighten me, hold me down. I couldn't find anything to lighten me. I was stuck. When I was in high school, I was hurting. Had to go around carrying around a burden I didn't understand, not having any sort of plan to get myself together. I panicked. Constantly getting myself into trouble, I struggled. When I was in high school, I needed help. I just needed someone to know how I felt, so I looked. You wouldn't believe the courage it took. When I was in high school, I found the Alex bus. I didn't know my school delivered healthcare right to us. I was scared. I didn't know what to expect. When I went on the bus, I met a nurse. Explained that I had anxiety and that it was getting worse. She cared. She listened to me as I spoke. Wasn't taking me as some kind of joke. I could feel myself getting stronger. Wanting to stay there longer, she paired me with a doctor. I remember my visits with Dr. Deb. I was there so often, she became my friend. She helped. We worked together on strategies, ones that would bring out the best in me, and it worked. I got better. When I went on the bus, I met Lyndon. He worked on the bus and would sit with me until the doctor stepped in. He showed me it was okay to share my opinions. I was relieved. I felt my chest opening, like I gave it permission to let go and grow something new. I knew the team on the bus wanted me to succeed. They provided me with all these great opportunities, helping me find a sense of identity, encouraging me to write things down or even keep a diary, ensured me that the resources on the bus would be available to me in its entirety. They had variety. I'm thankful. Grateful that they pushed me to hold on. I appreciate all the shoulders that I was given to lean on. This is the place that made me strong, made me feel like I belong. This community supports people like me. It supports all kinds of diversity. It means so much to me. They helped me discover who I was, develop better habits and even hobbies just because I'm happier, gladder than I used to be. And now, even in university, I know how to cope, how to hold on to hope and breathe, because the Alex team supported me. Thank you.
That poem makes me want to cry every time I hear it. Thank you, Huda, for sharing those words and for your talent and your story sharing with us. I want to thank everyone in the audience today sincerely for taking this time. I think we're all webinared and Zoomed to death, and we really, really appreciate you making this one a priority. I think we'll just wrap it up there, and I believe we covered most of the topics, and we'll try, as I say, obviously we have open communication. Please communicate with us with questions or whatever anytime, and we'll try to send out maybe a summary of anything we didn't cover. So to everybody, thanks again. Have a great summer. Stay healthy.